sir, first, although you don't need any introduction, but let me please get this opportunity to introduce you to our audience. So, guys,
Please go ahead.
Dr. Thapliyal sir graduated in 1979 from KG Medical College, Lucknow, completed his MDS from Armed Forces Medical College, Pune in 1987. Currently, he is the professor and head of Department of Oral and Maxillofacial Surgery in my college, that is I.T.S Dental College, Greater Noida.
Not now. I'm Professor Emeritus now.
Okay, sir.
I retired on 28th February.
Okay, sir. I wasn't aware of that. He has been the professor and head of the Dental Surgery AFMC Pune, head of Maxillofacial Team UN Peacekeeping Mission Hospital in Cambodia, Commandant and Command Dental Advisor Surgery CMDC Panchkula. He has been honored SENA Medal by the President of India on 26 January 2015. And guys, this is honored to individual act of exceptional devotion to duty or courage. He has been invited to treat maxillofacial trauma sustained by one of the ministers in the government of Kerala, and he has been the examiner at AIMS Delhi, KGMU Lucknow, published 57 national and international journals, 38 scientific papers presented, and guys, this is just the tip of the iceberg. He has done more, achieved more, accomplished more than I could ever say. So a warm welcome, sir, and thank you so much for coming. I know it has been little hard to get this session done, but it's truly what we all needed.
Actually, in the morning, I had a session.
Yeah.
It was a different kind of altogether.
Right.
So that took a little long time. It's about more than an hour. So otherwise, we could have done it in the morning.
Okay, no problem.
So anyway, guys, sorry for kept you waiting. And how many students are there online now?
Sir, there are around 40 currently.
Okay. Right.
And I will be saving
and they
the
are
session.
all undergraduates, graduates, postgraduates,
Yeah.
interns?
Right, sir. Exactly.
Right. Okay. Some of them are aspiring maxillofacial surgeon?
Yes, sir. Many of them actually.
Okay, great.
Sir,
yeah, what do you want to ask or what do they want to ask?
So my first question was, we start the final year subjects in the third year itself. So what is the best way to get the skills of oral surgery for the third year student and the final year student?
Okay. Skill means first you need to know the basics.
Right.
See, there are three parts of education, you know. The education had main three parts. One is the cognitive domain.
Okay.
Second is psychomotor domain. And third is affection domain.
Okay. Right.
So three parts of any study. So first becomes your psychomotor, that is related to your surgery. Means it is related to your skill.
Right.
Anything you want to develop, that comes under psychomotor domain.
Okay. Yeah.
And first part is cognitive domain. That is a knowledge.
Okay.
How you study anatomy, you study physiology, then you study biochemistry, you study basic subjects. That comes under cognitive domain.
Okay, sir. Right.
Okay.
Yeah.
That's second part comes affection domain. Affection is your emotions.
Okay.
Or your aptitude
right
towards the subject. Okay, what kind of a emotional person are you? Get nervous fast, or you are courageous, or you get scared of blood, or you don't get scared of blood. Okay, that kind of comes in the affection part. And third part is psychomotor.
Okay.
Of any study. That psychomotor is doing by hand.
Right.
Doing with your hand. Okay. So you have first got the knowledge. You have got the aptitude. Second, then you have got the knowledge. And third, you are learning your skill.
Right, sir.
Understood?
Yeah.
So all the parts of any study, and in maxillofacial surgery, your third part is the psychomotor part, is a very, very important.
Okay.
Okay, that is why third year, when you come to third year, it comes to the psychomotor domain of study.
Right.
So wherever you learn in first year and second year, you learn the basic primary subject like anatomy, physiology, biochemistry, pharmacology, and other things. So they have already, your teachers have already prepared you for your basic subjects. So you are well versed with the basic subjects. And then comes the time of applying that knowledge of basic subject into action.
Okay.
Okay. And then
Hanji.
you come to third year. And when you come to third year, you first start with the local anesthesia.
Right.
Okay. And you have learned local anesthesia theory. Now you will start using local anesthesia, how to give local anesthesia, various blocks. So
Right.
whenever you come to third year as a professor and HOD, I used to always ask, tell me who has invented the local anesthesia.
Right,
Okay.
sir. Yeah.
What is the composition of the local anesthesia? How does local anesthesia work? What are
Right.
the complications local anesthesia has? So until unless you know these things, learning the technique has no meaning.
Exactly,
So
sir.
first and foremost thing, when you come to third year and you are posted to Oral and Maxillofacial Surgery Department, you have to again revise your basic knowledge of anatomy. You must know what is the trigeminal nerve, how many branches it has, how it causes. Now you are applying it on the human body. Knowledge you have, now you are applying that knowledge. And that's
Right,
called
sir.
applied anatomy. Okay.
Okay.
So you now blending the knowledge of anatomy with applications. Okay.
Right.
So
Yeah.
you correlate your anatomy with jaw anatomy, and then you see where is the parotid, where is the pterygomandibular raphe, where is the mucosa, where is the pterygomandibular space, and where is the lingula, where is the medial aspect of the mandible, and then you locate lingula. So you know all these structure theory,
Right.
but you don't know actually how how you feel it when you touch the human body. Okay,
Exactly. Yeah.
so that thing, until unless you know the anatomy, you will not be able to understand where is lingula. So you need to revise your knowledge again of anatomy, and then you need to revise knowledge of your pharmacology. How is the pharmacology? How is the biotransformation of drugs takes place? How is the metabolism of drugs takes place? What is the effect of the drug on the human body? Okay, so
Right.
that's a pharmacology part. You will have to see how the drugs work, that pharmacology part. Okay.
Okay.
And then comes the physiology. Physiology means what kind of a blood circulation is there. Okay, how is that? What is the kind of a person having the respiratory problem? So what do you do in such situation? If the problem has with the liver function, so what do you do with that patient? How? Because liver has that biotransformation of the drug takes place in the liver.
Right.
Or if liver is already compromised, how will you how will you calibrate the dose until unless you know how the person's health? So then comes your history and other examination which has been taught to you. Okay.
Okay.
So now when you reach to third year, that your basic aim is to apply the knowledge of your anatomy, physiology, pharmacology into practice. That is your basic step and first step towards becoming a clinic.
Yeah, sir. Yeah. Yeah, yeah. We are back.
Okay, so have you understood the first part of
Yes, sir.
my thing? So when
Completely.
you're coming, so when you local anesthesia, then comes the anatomy of the mandible, anatomy of the tooth. Okay, you
Right.
are learning the extraction. Okay,
Yeah.
second part you learn extraction. Okay, how
Okay.
you give local anesthesia, and then comes the second part of the extraction. And in the second part of the extraction, you not only learn the technique, you learn about instrumentations, and you learn the philosophy behind using those instruments.
Right.
What are the various lever principles? How you using elevators? What are the various principles of using elevators? How you use forceps? What is the position? Where do you stand? And whatever you are learning at this stage, in the first year, first day or second day, that is going to be with you lifetime.
100%,
Whatever the
sir.
posture how you adopt now, like you adopt you for your extraction of the right side of a lower molar, you stand behind the patients. It will be always difficult, but if you get used to that, you will keep doing that.
Right.
So it is the time when you actually learn the best technique of doing it. You don't have your own technique. Means I am comfortable like this, so I will do it like this. If you are comfortable with that technique or with that kind of a posture, it might affect your health later on. You might have a cervical spine problem.
Yeah,
You may have a
exactly,
knee
sir.
or you may have other problems. Okay. So
Right.
you have to have a proper technique and proper postures, which is taught to you. Okay. And
Okay.
then come the how do you apply your instruments?
Right.
And again, holding, and for that you should know the parts of the instruments very well. Where is the
Right.
beak? Where is the handle? Where is the shaft? Where is the joint? And those how you maintain them when you go into your own practice. So you have to maintain your instrument for lifetime.
Right.
Okay.
Yeah, sir.
So unless you know which part works how, you will not be able to maintain them. It's
Right.
not that you work one instrument and then you don't maintain it properly. You will keep buying instrument unnecessary after a few years, and you will be wasting your money on that. So how to maintain instruments, how to maintain your equipment, that is also part of your training in the third year.
Right,
Okay.
sir. Yeah.
After that you learn, then it comes the technique of extraction. And technique of extraction means you should know what is the effect of injury on soft tissue, how the soft tissue reacts to injury, how the bone, hard tissue reacts to injury, and how the tooth behaves when you put a kind of a load.
Right.
Okay,
Right.
so you know the direction of the tooth, you know the direction of the root, you know the crown and root structure, and accordingly the forceps and elevators are designed. Okay,
Exactly.
if you use wrong instrument for, so there will be the first complication, that is a fracture of the tooth.
Right.
For example, I will give you one example. If you don't know the anatomy of the upper lateral incisor,
Right.
you will use wrong movement, and when you use wrong movement, it will break.
Break.
The root will break. Okay,
Yeah.
why? The root is inclined towards the palatal side,
Right.
lateral incisor,
Right.
whereas other roots are towards the labial side.
Yeah.
Lateral incisor root is towards the palatal side.
Right.
And if you give a first movement towards the labial side, generally you will break the root at apical third.
Right. Exactly, sir.
So your first movement will be towards the lingual side.
Right.
So you luxate lingual side and then give a palate, buccal side, and then go again palatally and deliver it palatally. Okay,
Right.
so that's the importance of learning anatomy.
Okay, sir.
So that knowledge of anatomy should be there in your mind, and accordingly you should be using your instruments, your movements, and other things. So these are the primary things. And actually, if you see the extraction, if you become expert in extracting a tooth,
Right.
So you understand the response of the body. Maybe it be a soft tissue, maybe a hard tissue, or maybe anything. So you start learning the response of the body, and you should be keen observer. Every patient teaches you something different.
True, sir.
You should keep observing. I did it like this in this patient. He reacted or she reacted it like this. So every patient is a new lesson for you. And but only thing, you should not go as per the what has been taught. You must start developing your own experience and keep noting down experience in your diary. Small, like you did this and it happened. So you know it. Why did it happen? So you can go little later. Oh yes, because of this X-ray, the figure was like this. There was a cementoma in that area. That is why it broke. I never went for X-ray before. So all these things you should learn from the day one, building your experience. And that's how within 30 or 40 years like me, or 50 years like me, practicing, so you develop your own experience. And then you don't depend on any books, you don't depend on anybody, you have your own experience.
Right, sir.
And that's the best experience. Okay?
Exactly. Sir, any books you would like to recommend which we should study while we are in third and final year?
See, nowadays there are many Indian books are coming.
Okay.
And Indian books are basically good books. Nilima Malik book, Oral Surgery, is quite good. And I know that it gives you a good foundation about the basic. But on top of that, suppose you are reading about fracture.
Right.
And any good student will not only depend on Nilima Malik.
Yeah, exactly.
He or she will go for an advanced version.
Right.
And there is a Rowe and William on fracture, maxillofacial skeleton. Or there are a series of K and Kelly.
Right. Okay.
Fractured mandible, fractured midface, fractured maxilla, fractured zygoma. There are a series. Similarly, there is a book, Sisher, by Sitcher, which is on cyst.
Okay.
Suppose you have read cyst, you have read about cyst from Nilima Malik. But any bright student or any student who has an aptitude to go for surgery will not be satisfied with that chapter only.
Right.
He or she will go for advanced version, and she will like to understand why cyst happens at all.
Exactly, sir.
And that detail you will not find in Nilima Malik. That detail you will find in book Sisher, because it's written only about cyst and how the cyst forms, what is the pathophysiology, what are the different classifications, and how cyst finally treated, what are the controversies in the management of the cyst. So in third year, finally, if you can devote some time, or if you have an aptitude for oral surgery, you can refer these books to answer your query if they are coming in your mind. Don't try to muck up things. Okay, never try to muck up things. Try to understand things first. If you are not able to understand, go to higher books, go to your teacher, ask your teacher, and get your doubts cleared first. And once you understand this subject very well, then there is no need of muck up.
Right.
You will remember it throughout life. Okay. Suppose if you the cyst, and if you know the hydrostatic pressure inside the cavity, which generates pressure onto the wall and it expands, and that causes the expansion of the cyst. So in which cyst there will be hydrostatic pressure?
Right.
Wherever there is a fluid,
Yeah.
it will have more hydrostatic pressure. But the cyst where doesn't have much fluid, it's only kind of aggressive, will not have that kind of a high pressure. It will just go into the least resistant area, like a keratocyst.
Right.
It doesn't expand the bone, but it takes into, because it's the aggressive kind of a thing. Okay, it doesn't put pressure.
Exactly.
Okay.
Yeah.
So you should know. Similarly, trauma. When you're talking about fractured mandible. So fracture mandible in isolation cannot be treated like fracture mandible. If the person has a fracture mandible, he may have other injuries also.
Right.
Along with that.
Yeah.
Okay. And along with the fracture mandible, he may be having a diabetes. He may be having a hypertension. But just treating a fracture mandible in isolation will not be good enough. So you should know if the person who is a diabetic and he has a fracture, how should he be treated, how his blood sugar should be maintained. If he is a hypertensive, how his blood pressure should be maintained during surgery or during that period, because his nutrition is compromised, his functions are compromised, his body undergoing catabolic changes. So everything will be compromised, and how you take the patient as a whole, I mean, it's comprehensive. That is important, and that will come with the knowledge of whatever medicine you have studied, whatever surgery you have studied, okay,
Right.
and to apply that knowledge here. So it's a comprehensive management of the patient. That is why your subjects are like this. You have been taught medicine, you have been taught. Why otherwise for extraction of a tooth, why medicine should be taught?
Yeah.
Okay, because extraction of a tooth is not in isolation. It's a part of a body. It's an organ. It's an organ.
Yes.
So when the person is losing that organ, his body biologically, emotionally, psychologically is getting affected.
Right.
So you should know the psychological aspect of the patient also. If the young lady who loses her front tooth, what psychological trauma she will be undergoing.
Right.
So you should know, yes, how to prevent this psychological trauma. What best I can do? Suppose the lady falls and she is riding a bicycle at 17 or 18 years old, and she falls on the ground and she breaks her one tooth, and she collects it and she comes. Your first effort will be to restore the aesthetics of this young lady.
Right.
Not go for just extraction.
Exactly.
Okay, I will remove this or this infected.
Yeah.
So all these aspects, oral maxillofacial surgery, you should keep in mind, because it's a one specialty where you are not treating things just inside the mouth. You are seeing the overall body.
Right.
And overall body, how it responds to trauma, how it responds to injury, how it responds to any kind of intervention in the mouth. It's the same as anywhere in the body.
Okay. Right.
You have some injury somewhere in the throat region or ear region. So response is same.
Exactly.
Body is a response in the same way. So why should you be away from learning medicine? You should learn medicine also. You should learn surgery. You should know how to examine chest, how to palpate liver, how to palpate spleen.
Right.
Okay, how to use a stethoscope for recording breathing sounds. How you see abdominal sounds. Okay, all these things should be part of your training, and you should not ignore when you are in third year learning medicine. You must learn medicine very well. That will help you in long run.
Exactly, sir.
Okay.
Thank you. So now we are in internship. So when we are posted in the Department of Oral Surgery, what can we do to get the best of the experience from it?
First thing, what I have seen in the college, in third year and final year, your main emphasis remains finishing the quota.
Exactly, sir. Yeah.
And in the process of meeting your quota, you actually forget what is the purpose of being there in the department.
Right.
Okay. Quota will come if you are very sincere and if you are working hard. Okay.
Yeah.
Quota, you can fix 50 extractions in a year or 2 years or nothing. And even your professor and HODs are not so strict about it. I was not, because I knew if a student is very good, she and he knows the right technique, there is no need for pressing that you must have 50 number, you must have 50. No, it's okay. You can have a test. Okay. So that your emphasis should not be on quota even during internship. Or internship is the time when you actually commit mistakes.
Exactly.
And you should not be scared of committing mistakes. More mistakes, more blunders you commit, better person or better clinician you become.
Right, sir.
So don't try to venture out everywhere. Take every kind of a challenge during internship, because there are teachers who are supporting you. Anything happens to a student, you are not responsible. Your teacher is responsible.
Right.
Something happens Something happens to your patients, he will not blame you. He will blame your teacher. So under the guidance, under the shadow of the teacher, you must learn, and your aim should always be to learn maximum and maximum. If the oral surgery department has a OT day and they're going to OT, your aim should be always to visit OT. What is the OT protocol? How the decorum, how you maintain the decorum OT, how you pick up the instruments from the trolley, how you maintain, how you keep your hands away from getting infected. All those parts, how you wash your hands, how you wear your linens, how you gowns, draping, how you scrub the face, how you prepare the body.
Right.
Everything you should know. And once you are expert in oral surgery, the first thing what happens, your fear of blood goes away.
Exactly.
Okay?
Yeah.
Second, your fear of patients becoming unconscious and then आपके हाथ पांव फूल जाएं, that goes away.
Right.
Okay?
Yeah.
So your posting in oral surgery makes you brave, makes you courageous. Okay, and that you must utilize to the maximum. Any person or any patient is fainting in your surgery department, you must go and try to learn from, okay, how to revive this patient. So whatever knowledge you have, you take a help. And anybody who is coming up with a huge swelling and patients not breathing properly, and your doctor some incision and drainage, immediately you should know how to do the incision and drainage there. Because that is the emergency you will be facing sometime in your lifetime.
For sure.
And these are the emergency procedure. If you are good in handling emergencies, you will be a fearless person and you will do good job and you will remain confident. But if you are not confident about managing emergencies, the fear of losing patient or fear of complication will always keep bothering you, and you will not be taking you will not be progressing the way you should progress. Okay?
Yeah.
So you must know the emergency, how to handle the emergencies.
Okay.
You must know how to, what are the medicines are required to handle the emergencies.
Right.
What are the equipments are required to handle the emergencies. Those things you must know in while you are posted in oral surgery department as intern.
Okay, sir.
So you know your, what are the various, like a CPR process, how is it done. Okay, so when the patient becomes unconscious, how you make the patient conscious. If there is a patient who has got already compromised, how you do the pre-medications and you bring him to the normal and then go for surgery.
Right.
So all these things you should know, you should learn during your internship.
Right.
Internship is the best time in your lifetime where you learn things and where you enjoy your posting.
Exactly.
Okay.
Yeah.
You learn with fun, and there is no responsibility, no accountability. At the same time, you are working under the shadow of your teacher.
Right.
Okay.
Yeah. Sir, when we choose, everybody wants to choose MDS in oral surgery. So everybody wants to become an oral surgeon. So sir, when we choose MDS, what are the basic curriculum? What exactly we learn, and what is the scope of it in India and abroad?
Scope of oral surgery in India and abroad. Okay. See, oral surgery is one specialty which cannot be done without being in a hospital first.
Right, exactly.
Okay. You have to be in hospital, then only you can practice doing like impaction, doing some implants and doing some minor oral surgical procedure. I will not call it a maxillofacial surgery. That even BDS can do it if he or she practices with some maxillofacial surgeon and she becomes expert, and you can learn these techniques.
True.
But moral surgery, I'm talking about when you really want to become a maxillofacial surgeon. So scope is from impaction to the base of the cranial surgery.
Okay.
You can go up to the base of the cranial surgery.
Okay.
And you can do the craniotomy, you can do the cranial plasty, you can do various congenital disorder of the face, you can go for reconstructive surgery. I mean, the scope is tremendous. You can go for various aesthetic surgical procedures. You can only choose trauma. You can only choose reconstruction. You can choose only aesthetic part. You can choose only cranial based surgery, or you can choose only implants, or you can choose orthognathic surgery, or you can choose distraction osteogenesis. So scope is tremendous.
Exactly.
But you should have the interest and aptitude for doing this. And for doing this, you need a lot of study. You have to, because when you become a maxillofacial surgeon in a hospital, you are exposed to all kinds of specialists which are eyeing at you.
Right.
Because the specialty of maxillofacial surgery is the specialty which is the most lucrative as of now. The plastic surgeons are eyeing at that part. ENT surgeons are eyeing at that part. Head and neck surgeons are looking at that part.
Right.
So anybody who is doing best in that sector will be rewarded, will do well, and the person who is not doing well, he will be punished. So, and more of the time, like you are exposed to anesthetist when you are operating,
Right.
and your anesthesiologist is the best judge of yours, who will tell you and who will go and tell, okay, if you have a fractured mandible or you have a fractured maxilla, don't go to this plastic surgeon, go to the maxillofacial surgeon, because the maxillofacial surgeon does a good job.
Right.
Okay.
Yeah.
So your confidence and your handling of the tissue, the way you are handling, will impress your anesthesiologist, and he will go and tell people, you go there. If I have a problem, I will go to this gentleman, not to. But there are, because people are coming, plastic surgeons are coming in trauma, ENT surgeons are coming into trauma, head and neck surgeons are coming into trauma, even general surgeons are, because it's a highly paying,
Yeah.
much paying. Orthognathic is a highly paying specialty. Okay.
Right.
So you should be expert, and you should aim always high, not remain those who are maxillofacial surgeon. I'm talking to them.
Right.
Okay, already. They should always aim high. They should go for like for fellowship in oncology.
Yeah,
head and neck
exactly.
oncology.
Yeah, yeah.
Should go fellowship in cleft and lip and palate. They should go for fellowship in facial trauma. They should go for fellowship in orthognathic surgery. So like that. Okay, they can always choose special branches.
Right.
And there's no end of in maxillofacial surgery. You can achieve a lot, and you can become expert in a particular field later on, because you can't do everything. So as you are advancing in the field of maxillofacial surgery, your scope becomes narrow and narrow and narrow and narrow.
Right.
Okay, you are choosing a small branch. Like some maxillofacial surgeon will be expert in temporomandibular joints.
Yeah. Right.
Okay, some maxillofacial surgeon will be expert in salivary gland surgery.
Exactly.
Okay, and that will come in a long way. Means they have done everything, they have done training in that, they have been getting experience. Like somebody that nowadays, some maxillofacial surgeon are actually expert in parotid surgery.
Okay.
So this kind of a thing, scope is tremendous in maxillofacial surgery. Okay, but in maxillofacial surgery, you don't limit yourself to only oral cavity. You should learn everything, whatever a general surgeon, whatever the plastic surgeon, or whatever a neurosurgeon supposed to know. You are supposed to know everything.
Sure, sir. Yeah.
Okay.
So now I would like to come to the army part. How and why did you choose army, and like how can a BDS get into army? Because nowadays scenario has changed. We have to appear for the NEET exam so that we can get admission into army. So how is that life? How is the process?
Okay. First question you asked me, how did you choose the army and why did you choose the army?
Right,
okay.
right.
My story is different because when I was in KGMC Lucknow, I was pursuing my MDS in periodontics.
Okay.
Okay,
Yeah.
in pediatric dentistry, and almost 1.5 years I had done.
Okay.
Just 6 months left to appear for the examination,
Okay.
and there was Army General who visited our college, and I met him and I got impressed with him.
Okay.
I spoke to him, I want to join Army. He said, welcome, you appear for the exam, you appear for the interview, we will take you. So I appeared for the exam, I appeared for interview, I got selected, and I left MDS,
Okay.
periodontics, just 6 months before and joined Army.
Okay.
And periodont, I had got nothing against periodontic. That was
Right.
my first love.
Right.
But oral and maxillofacial surgery had been my choice of specialty.
Okay.
So when I went to Army, I chose maxillofacial surgery, and then I did my MDS in maxillofacial surgery from Armed Forces Medical College.
Right.
So that's how I was always fascinated towards Army, because Army gives you a good life. So Army doesn't give you much money,
Right.
but your life is different. You get exposure all over India. You even get exposure to foreign countries, and you meet people from all parts of India, and then you remain as a one unit where the South Indian is there, Keralites is there, Assamese is there, then some from Himachal, some from Punjab, and you live in the kind of a family.
Right.
That kind of a family, I liked it most, and that was my reason. I mean, joining Army, because it was one of the best service any government can provide.
Exactly, sir.
And you have freedom of working, you have got a kind of a respect you have, and you love your uniform. And I loved my uniform every time.
Right.
Whenever I wore uniform, I used to feel proud of my uniform. So that was the thing why I joined Army. And as a professional, then I came into teaching from academic. I came into academics, and then I was in research also
Okay.
at Institute of Nuclear and Allied Sciences. So you can imagine the Army joining gives you complete all kinds of exposure.
Right.
I learned golf, I learned tennis there, I did horse riding,
Yeah.
I did everything. At a young age, when I was captain, I was in the field area. So everything I was doing.
Right.
So it gave you everything, tremendous exposure to your sports, tremendous exposure to your social gatherings, and your overall personality development.
Exactly.
It gives you opportunity. It gives you. Otherwise, in civil or in outside, you remain focused either to your work or to earning money or to your family or nothing else.
Yeah.
Not more than. Okay. So that was the reason I left Army, and I had been fortunate to have enjoyed both ends, like Army also enjoyed. And after Army also, civil I've enjoyed thoroughly. And civil especially, I got so much of a love from students. And that really gives me a lot of satisfaction, more than actually satisfaction, which I got in Army. When my student talks to me and when they speak to, like when you approach me, I said, okay, I will give you time. I'll speak to you and I will definitely.
I'm so grateful, sir.
So that's the okay.
So many people, many students are very tense regarding.
You are asking how to join
Yes,
Army.
sir.
Okay. So I'll answer that. For to join Army, BDS can join Army. There's no need to go for MDS and then join Army.
Exactly.
In fact, it is better as a BDS to join Army. You only have to appear for NEET examination,
Right.
and you should get qualifying marks for that. So once you qualify NEETs, then you apply through online, or I don't know what kind of now the procedure is there. So you apply. Every year there are vacancies. It comes in the newspaper,
Right.
and you come to know, and you apply for Army. So Army will actually now see all of those who have qualified NEET, they will prepare a merit list.
Right.
And based on the vacancy they have, 15 times of the people will be called for interview.
Okay.
Multiply by 15. Like you have one vacancy, so 15 people will be
Right.
called. If you have a 10 vacancy, 150 students will be called, and that will be a merit list. From top 150, finished, then only beyond that, even the person who is on 151 list will not be.
Right. Okay.
Okay, the 150 person will be called, and that there will be a just interview, no written examination.
Okay.
An interview will be in Delhi Army headquarters or in RR hospital.
Okay.
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 So interview, there is an interview board which includes various specialists from various branches. There will be a specialist from medicine. There will be a specialist for dentistry. There will be a specialist from civil health center, means CGHS, Central
Right.
Government Health Services. One person from there. There will be a person who is a psychologist
Okay.
by profession, who will be reading your psychology while you are answering the questions.
Right.
And then there will be a administrator who talks about admin.
Okay.
Okay. And that interview will be a very simple interview. It's basically to check your aptitude,
Okay.
to see your knowledge, to see your personality, how amenable you are. If you are rigid, you have no place in the army.
Right.
You have to be amenable. Okay, if you are rigid to your thought, you're rigid to your principle, rigid to your lifestyle, you have no, and even if you get into the army, you will not be a successful. So malleability and adaptability to various situations, whatever it comes, it should be your own. Suppose today you are posted in a field area like Leh.
Right.
There you get a small room and you are under very adverse conditions. And if you are not a person of very malleable, adjustable, or you can't gel well with your surroundings, you will be frustrated and you will say, oh, where I have come, I must leave this army. And then when you come to Delhi, you get a house and you get everything and then you feel good. So it's not that wherever you are, you must get into it. You must accept everything. And that aptitude is checked during interview.
Okay.
Whether you are going to be an very rigid person, or you are going to be an adaptable person, malleable person who can, and what kind of a discipline and what kind of a obedience that person will have.
Right.
Okay, because obedience is one of the most important factors, that you should be obedient to your seniors and you should have a leadership quality to your juniors.
Right.
So you should have those qualities, they will check in you. And then the third factor in army is your officer-like qualities, OLQs.
Okay.
We call it OLQ, officer-like qualities, like how you walk, how you enter, how you speak, how you dress up.
Right.
Okay, what are your various movements when you are speaking?
Right.
Okay, these are the type of qualities are checked, called officer-like qualities, because you are going to be an officer, class 1 gazetted officer in army, and you are interacting with all kinds of officers from different arms, and they all are trained very well in different institutions, though you don't get that kind of a training being a doctor, but still you should be able to adjust with them. You should be able to interact with them. You should be able to put your view across to them the way, and your communication skill. So very, very important.
Right.
Okay.
Yeah.
So all these factors combined together makes your personality. So personality is chosen.
Exactly, sir.
Okay.
Right.
Okay.
Sir, there were questions of doubts, like people wanted to know if they are wearing specs or if they have a tattoo. Are they allowed? Can they be in the army as a BDS?
Yes, yes. Specs can be allowed. It's a limit is that with the specs should be 6 by 6,
Okay.
and there is some kind of a limit. I don't remember exactly what
Right.
is the limit, but with specs, yes, you are allowed.
Okay.
There are so many army generals wearing specs.
Right. Okay, sir. Sir, any tips you would like to give for the people who will be going for the interview in army? Anything you want to convey to them?
Tip means they should be. I told you those
Right.
qualities. First thing, they should be absolutely fearless. There should be no fear in their mind.
Okay.
Okay,
Okay.
fearless. Fearlessness is one factor which makes you confident. Okay,
Right.
so there's no fear. when you are entering the hall, but at the same time, you should not show arrogance.
Exactly. Yeah. Yeah.
Okay. Fearlessness doesn't mean that the person is arrogant. You are humble, at the same time, you are fearless.
Right.
Second, you should look very confident, and that confidence comes only in your eyes when you know the subject very well.
Right.
Okay. If you don't know the subject very well, your eyes will not look very confident. And when you look into the eyes of the candidate, it is known the person is a confident or not confident.
Right.
Okay.
Yeah.
And the first questions they will ask you only if you're looking overconfident, they will try to break your overconfidence first.
Exactly.
And how fast you break, that is also is checked. If you don't know the subject, that should not break you.
Right.
You should always ask, sir, I don't know the answer of the subject. Please ask me some other question.
Okay.
Or if you keep thinking, oh my God, what is happening? And tears start rolling on your forehead. So it means you are broke.
Okay. Right.
Or some sweat comes on this thing, and it means you are broken. So when you are broken, you are not a good person for army. So you should know that I don't know. You should know your weaknesses and you should know your strength.
Right.
So we should do, on one side, you should write your strength. On another side of the copy, you should write your weaknesses. So your aim should be every day to remove your one weakness and add one strength to the side. Okay.
Yeah.
So ratio of your weaknesses versus the strength should not be 1:1. It should be 2:1. 2 strength and 1 weakness.
Right. Okay.
Weaknesses you can't completely eradicate his strength. After all, human beings have a weakness.
Right.
But accept your weaknesses. Yes, I have a weakness. I'm an emotional person. So that's the weakness.
Yeah.
Okay? I get stressed very fast. That's a weakness.
Right.
Okay. So you must know your weakness. I'm a shy person. So that's a weakness.
Right.
Okay.
Yeah.
But if you're shy, so means how you become confident, how you remove shyness, that you should work on that.
Okay.
So best know those who are aspiring to join army, they should know their weaknesses, they should know their strength. And keep increasing your strength and keep decreasing your weaknesses.
Right.
Okay?
Sir.
And it comes with your own working with you.
Right.
Nobody will tell you this is your weakness and this is your strength. You have to work on yourself.
Right.
You are the best judge of your life. You know your weakness, you know your life. Don't accept anybody tells you, oh no, you are this like this, you are like this, or somebody praises you, oh, you're a great, you're confident. Don't believe in the person, believe in yourself. What I am, I am.
Exactly.
Okay.
Yeah.
So this question is I wanted to ask this, and it's little different from your theory of dentistry or the practical of dentistry. I wanted to know, sir, what are the skills of a leader?
What are the skills of a leader?
Exactly.
Okay. The first and foremost thing, the leader should lead with example.
Okay.
Always you do something else and you expect something different from your subordinates, it will never work.
Okay.
Okay. So you lead with example. First, you should know the subject, you should know everything well, and you should do that first, and then others will follow you. And they will listen to your command, they will listen to your advice, they will follow you. Okay. That is the one. Always lead with example. Okay.
Okay.
Second thing, you should always not be selfish at all.
Right.
Selfishness is the quality which kills a leader. If you are selfish about, you only think your self goal, you only think about your self interest, and then take people around you, this will be very short lived leadership. It will die very soon. Okay. So
Okay.
you should always first look the welfare of people under you, and then your welfare should come second.
Right.
Okay, that's one.
Okay.
Second thing, wherever you are working as a leader, maybe corporate, maybe any industry, or maybe college, or maybe anything. So you should be compassionate to your people where you must listen. You must know their name, remember their name. If you are a leader and you call, hey, suno, idhar aao, so means you have lost that leader. If you know Ram Sevak, idhar aao. So Ram
Right.
Sevak will know कि yes, साहब मेरा नाम जानते हैं.
Right.
Okay, and ask
Right.
him any problem you have in life, anything, any domestic problem, how your children are doing, how is your wife, any problem. So must always converse, communicate with them.
Okay.
Don't keep a picture that you are the boss and you have a subordinate with you. I must work like a danda. No, that never works. Okay.
Okay.
So leadership qualities you have to build as and when you are actually going ahead in your profession or going ahead in your whatever you are doing.
Right.
Okay.
Yeah.
So those.
Uh,
So these are the
uh,
basic 3-4 points up to.
right. Sir, any message for BDS who doesn't want to do MDS but wants to get all the skills a BDS can? So, what is your advice to them for a BDS? How can they
Yes.
shine?
Okay. BDS doing MDS is not always advisable if if your financial condition is not good and
Right.
if you have much time.
Right.
Okay. Time
Yeah.
is short. Somebody is getting married. The parents are forcing, no, marriage is the first and then study. Now we have done enough. Now we don't have money. Now we can't afford. And even
Yeah.
you are having a lack of interest that you can't study anymore. In that
Right.
situation, you have to survive. Okay. So
Exactly.
BDS is not that on plain BDS will not survive. But nowadays, it is the time where you have to learn some skill or the other skill. Just by
Right.
doing extraction or filling or doing scaling, you will not be able to survive. You have
Right.
to learn. So you will have to learn a root canal treatment. You will have to learn minor oral surgical process. You will have to learn some kind of pediatric dentistry procedure. You will have to learn some prosthetic procedures. And moreover, if you are not MDS and you are just BDS, you should go for some kind of short courses like facial
Right.
non non-invasive facial aesthetics like Botox,
Okay.
fillers,
Yeah.
okay,
Yeah.
some kind of a thing you can add to your profile. Okay, that will
Right.
help. That will help to build your reputation outside. So you are a
Right.
facial aesthetic dentist. Okay,
Okay.
or you have a smile design person. You design the smile. So for
Right.
those, and another area is you do implants. You don't need to become MDS to learn implants. You do some
Right.
course in implantology and you learn implants. You will do well. People actually generally don't see degree only. People go by a work. And that work goes from patients mouth to mouth. Patients, when patients, you do good job, your reputation actually moves very slowly. But if
Right.
you do a bad job, it's like a
It's fast. Yeah.
broadcasting. People will say, "Oh, never that person." Okay, but if you have
Exactly.
done a good job, he will never say, "Okay, she did a good job." But somebody asks him, "Where should I go for this treatment?" He will say, "Oh, go to her. She's a good,
Right.
she's a good dentist." So your and it should be. You should not be always in hurry to make money. You should be
Exactly.
always be confident about yourself and build your reputation first. Okay, your aim should be to build your
True.
reputation, to gain more skills and then practice, and gradually you will learn, and your patient number also will keep increasing. Okay, so that's it's not, don't get frustrated that I have not done MDS or an MDS I couldn't do. It's not required MDS. The person who does MDS in oral surgery, he is like any BDS for endodontics. Even worse than worse than this thing. The person who does endodontics, he is the worst prosthodontist because
Right.
his focus is went towards endodontics. He is not focusing on prosthodontics. But as a BDS, your focus is equally divided to all these. So you will be a good prosthodontist, you will be a good endodontist, you will be a good. So you will be a good general practitioner.
Right. Exactly,
Okay,
sir.
so you
Yeah.
must add to your qualification, you add to your skill. Gradually, you may work with under somebody who does good root canal treatment, learn from him. Somebody who put good implants, not accumulating certificate. It looks good when you have display them in the clinic, but actually, if not for the knowledge, not for the skill, you that skill and everything you learn from people or your guru, make somebody, yes, teach me this, and I
Right.
want to do this. Okay, that you can.
Yeah.
But BDS can do wonders. It's a general practice. BDS can do wonders. There's no problem in it.
Okay.
Okay, but if you have a money, if you have a time, and if you have an aptitude, then go for the specialty which you like most. Not that you don't see oral surgeon has a future only in hospital. Endodontics will be best because you will be on call and you can do thing. It will be easy. But if you don't have an aptitude for endodontics, that will be a failure. Okay, you should have an aptitude. Okay, and the specialty which you like from your heart, do it. You will flourish.
Right. Thank you, sir.
Okay,
Just,
and happy to
just.
understand. Okay, thank you. Thank
Thank
you.
you. Thank you so
Thank you.
much, sir.
Thank you. Thank you.
Thank you so much.
Bye.
Bye, bye, sir.
Bye.